Also, these are the statistics that I quote them. These aren't mine. These are published data that have already been presented today as far as the risk of recurrence with any type of operation. And again, I will state to my patients that I'm sorry if you don't like the bulge, but the purpose of a ventral hernia repair is not cosmetics. It's for functional improvement, optimize your function. I'm sorry if you don't like the way it looks, but unless it's impairing your function significantly, I will not offer them repair. And I am a believer and a disciple, I guess, of a component separation with either a mesh or a matrix buttressing that repair, preferably in the retrorectus, the preperitoneal space. That's my ideal for large repairs, anything more than has been discussed, 6 centimeters or so. However, it really depends on the operation, what you find in the operating room. So that will come with qualifiers depending on what I see at the time of the operation, what I see on CAT scan findings beforehand, and I'll discuss that with the patients. As stated before, I have a plan A, a plan B, a plan C, even plan D sometimes on what actually might be done at the time of the operation. I think that's just the reality of when we get in there, what's going to be can be done. This could be a primary myofascial closure with an underlay of the SurgiMend acellular dermal matrix as a 1.0. I will use the fenestrations at times to try to prevent a seroma formation, just to try to make sure that I have adequate matrix and tissue interface, because I think that will improve the amount of ingrowth. Either an onlay at times, depending on what adhesions that may be and what allows my underlay repair. A component separation with a primary closure to underlay, as I've stated, with the SurgiMend 3 millimeter thick. Sometimes I have to put that as an onlay, and even sometimes, despite best efforts to try to do the component separation with primary myofascial closure, as we all know, sometimes you just can't get all that tissue together. And I will go over some cases where we've used the bovine matrix to bridge that partial closure, and bridge repairs, which we'll discuss.